coming to the few people that showed up on time. I'm going to walk you through two different approaches of medicine, Western medicine and traditional Chinese medicine. I'll be referring to TCM. Instead of really trying to find out which one is better, I wanted to tell you how they can work together and how they are different. So first, medicine is something in every culture has had to figure out because people everywhere got sick or injured. Western medicine and Chinese medicine grew out of completely different perspectives and philosophies. By comparing them, we can see how each side looks, how differently each side looks at it, and maybe understand why combining it has become more common recently. First, Western medicine. It's something that we are probably most familiar with. So it's something, it's a science, it's based on science, biology, chemistry, and anatomy. Doctors use tests, scans, or lab results to find out what's going on inside of your body. It also, to fix problems inside your body, they use prescription drugs, surgeries, or standardized care plans. It's very precise and very effective, especially for acute issues. Acute meaning urgent, needing urgent care, and things like infections, injuries, or emergencies. So Chinese medicine, it has a very long history. It goes back thousands of years. It's built on a very different foundation. It's based on qi, which is thought as like the body's life force, and the balance between yin and yang. Instead of focusing on the disease, they actually focus on your body system and how they are in balance. Treatments include acupuncture, herbal medicine, massage, or just a dietary therapy. This is a side-to-side comparison. So Western medicine focuses on more of finding and treating a disease in a specific organ or tissues. Chinese medicine focuses on balance and more or less prevention than really curing the disease. Western doctors rely on tech and drugs, while Chinese medicine uses things like herbs, acupuncture, and qigong. I'll get into that more later. They are trying to achieve the same goal, but in very different ways. This is a very fast video on Chinese medicine.
Okay.
There's no sound.
Okay. It should go out on HDMI. I think we should move on.
Yeah, this is not much to do. It just kind of repeated what I said earlier. They use different kinds of methods and ways to cure. And this is also overview for Western. Okay, so to go over the positive four strengths of Western medicine, so we have its precision and speed. So with the advanced tech we have today, we can see inside the body with MRIs or CT scans, surgeries, repair injuries, and save lives in emergencies. Antibiotics and vaccines have wiped out or controlled deadly diseases. And because everything is really standardized, patients usually know what to expect. And because everything is, it's especially powerful in emergency and acute care. If you're having a heart attack, Western medicine is where you want to be. So strengths for TCM, traditional Chinese medicine. It's very personalized. Treatment is tailored to your body and not just to the disease. Because it uses natural remedies and non-invasive techniques, its side effects are usually far less than what Western medicine has. It treats chronic issues like stress, digestion, or fatigue, something that Western medicine sometimes struggles with. And of course, it has thousands of years of tradition backing it up, and that's why it is practiced worldwide. So just a few specific treatments for Western medicine. Blood tests usually find out if you have infections or whatever's going on in your body. MRIs, it uses strong magnetic fields and radio waves to create images of your body. And CT scans, it uses X-rays or radiation to create detailed cross-sectional 2D or 3D images of your body. So the difference between these two is MRIs are usually a lot more expensive, but the positive side is that they are way more detailed and you can see very small changes in blood flow or small changes in tissue. CT scans, it's way cheaper, it's a lot faster, but the radiation is definitely a risk. And physical exams, so every year you go to a doctor to get checked out, that's a physical exam. So traditional Chinese medicine, acupuncture, tuina, it's also just a kind of massage. Moxibustion, burning mugwort on a certain point on the body. It can potentially cure colds, aches in the body, chronic pain. Cupping also creates suction on the skin to accelerate blood flow in a certain area to promote healing. And more on treatments. So there's mind body practices and herbal therapies. Herbal medicine uses plants like ginseng, renishan in Chinese, licorice root or goji berries to support balance. Tai Chi and Qigong is kind of just like a form of exercise to increase flow inside the body and accelerate, I guess it calms you as well. Meditation is also important, helping calm the mind and body and achieve the stability and balance inside the body. So, now there are applications of traditional Chinese medicine. I will go over more examples in the presentation. Acupuncture is common for pain and pain management in like arthritis and migraines. Cancer centers are now using it to treat like post-chemo symptoms. Herbal medicine is used for things like digestion or allergies. Globally, organizations like World Health Organization has officially recognized acupuncture as for specific conditions.
Sure.
Medicine and Western medicine take fundamentally different approaches to diagnosing and treating illness. Here are some key differences between the two medical systems. First, the philosophy that builds the foundation of the systems is different. Chinese medicine focuses on balance and harmony within the body. It views health as a result of the balanced flow of vital energy and the opposing forces of yin and yang. Western medicine employs a reductionist approach, aiming to identify a specific cause of disease through scientific methods. It emphasizes isolating and treating the malfunctioning parts of the body. The second difference is in diagnosis. Chinese medicine relies on holistic evaluation, including looking at the tongue, pulse, and overall physical appearance. Diagnosis considers a person's emotional state and lifestyle factors. Western medicine utilizes laboratory tests, imaging techniques, and physical examinations to pinpoint the cause of illness. Thirdly, the difference in treatment. Chinese medicine employs a variety of techniques to restore balance in the body, such as acupuncture, herbal remedies, dietary therapy, massage or tuina, and exercise like Tai Chi and Qigong. Western medicine primarily uses pharmaceutical drugs, surgery, radiation, and other procedures to target the disease or its symptoms. Let's take the example of treating headache. Depending on the type of headache, a Western doctor might prescribe pain relievers, muscle relaxants, or medication to target migraines. A TCM practitioner might use acupuncture to target specific pressure points believed to be associated with headaches. They might also recommend dietary changes or herbal remedies based on the TCM diagnosis of the headache type, for example, deficiency of qi or blood stagnation. For arthritis, Western doctors might recommend pain medication, anti-inflammatory drugs, physical therapy, or cortisone injections to manage pain and inflammation. In severe cases, surgery may be considered. In Chinese medicine, acupuncture and acupressure are common approaches to manage pain and improve joint function. TCM practitioners might also recommend herbal formulas and dietary adjustments to reduce inflammation and improve circulation. For digestive issues, Western doctors might prescribe medications to address specific digestive or antibiotics for bacterial infections. A TCM practitioner might use acupuncture or massage techniques to improve digestion and address imbalances in the digestive system. Herbal formulas would likely be prescribed based on specific digestive issues like diarrhea or constipation. These are just a few examples, and the specific approaches will vary depending on the individual and the severity of the condition. As a whole, Chinese medicine emphasizes prevention and maintaining overall well-being. It treats the whole person, not just the symptoms. Western medicine focuses on treating specific diseases and their symptoms. It aims for a cure or effective management of the illness, so they have different focus. When it comes to scientific evidence in Chinese medicine, many practices lack extensive scientific research to validate their effectiveness for specific conditions. Western medicine relies heavily on scientific evidence from clinical trials to determine the efficacy and safety of treatments. Both Western medicine and traditional Chinese medicine can have side effects, though they differ in nature and potential severity. For Western medicine, the most common side effects come from prescription and over-the-counter medications. These can range from mild headaches, nausea to severe allergic reactions, organ damage, depending on the medication and individual. Surgeries and other medical procedures inherently carry risks of infection, bleeding, and complications during the procedure itself. Additionally, there can be post-operative side effects like pain, scarring, and limitations in mobility. Radiation can damage healthy tissues near the targeted area, leading to fatigue, skin irritation, hair loss, and even an increased risk of cancer in some cases. For Chinese medicine, many herbs can have side effects, especially if taken in high doses for extended periods or without proper consultation. These can include digestive issues, headaches, allergic reactions, and drug interactions. Generally considered safe with minimal side effects, acupuncture can occasionally cause minor bleeding, bruising, or dizziness at the insertion site. There's also a small risk of infection if needles aren't properly sterilized. While generally promoting healthy eating, following a TCM diet too strictly could lead to nutritional deficiencies if it excludes certain food groups necessary for a balanced diet. Western medicine remains dominant, but there's growing openness to incorporating TCM practices with proven benefits. While both Chinese medicine and Western medicine offer valuable approaches to healthcare, the ideal scenario may involve finding ways to combine their strengths for a more comprehensive and effective healthcare system.
Okay, so one thing I would probably disagree with the video though when they said acupuncture side effects, that only happens if the practitioner is not properly trained, I guess. They're not careful enough. But, so an example is this site. The site is listed above on the slide, so if you do want to research more, it is there. It's a UCLA, what they call it is the East-West medicine. It's UCLA Center for East-West Medicine. It's a clinic where doctors are trained in both Western and Chinese practices. In here, you can actually get like scientifically proven treatments and also holistic treatments. Yeah, the impact has been huge. Patients have reported fewer symptoms, less reliance on drugs, which is pretty big for this era, and better quality of life. Next is Harvard. Harvard did research acupuncture. There are actually measurable effects that acupuncture has. For example, from a Chinese perspective, what they would say is that acupuncture clears a blocked qi, while Western scientific perspective, it stimulates the nervous system to release endorphins and neurotransmitters. These, in turn, cause pain to ease the pain and boost your mood. This is now widely used for chronic pain, arthritis, headaches, post-operational recovery, like surgery, and even menopause or addiction treatment. So